Ciao mundo, hello world, hola mundo, hello monde, konnichiwa, ni hao. We are here in New Orleans for the American Society of Nephrology and Kidney Week, and I'm again with my friend John Kellum from Pittsburgh, who just published in C. Jason a fantastic paper with a tremendous impact on healthcare and healthcare expenditure. So John, can you summarize this wonderful findings?
Well, thank you, Claudio. It's actually coming out in Jason. Just came out actually. What we did basically is we looked at 500,000 patients in Western Pennsylvania before and after instituting a simple computer alert in the medical record system to basically allow for clinicians to more easily identify acute kidney injury. And what we found was that there was a decrease in mortality by about just under 1%. There was a decrease in length of stay by about a quarter of a day. If you take this across, if this were generalizable across the entire United States, for example, where there are 2.2 million people who develop acute kidney injury every year, you'd save about 17,000 lives and about $1.2 billion annually, which is actually, I think, more than your budget.
It is. So is this alert prompting something like the nephrology rapid response team or something similar?
Well, so I think for me that's sort of the next step in all of this. And of course, as usual, you're ahead of us, although you haven't done it in 500,000 patients yet.
Not
Tell
yet.
us a little bit about the rapid response team in Vicenza.
No, the rapid response team was extremely effective. We actually achieved a reduction of almost 20% in the overall cases requiring renal replacement therapy. So I think this is an incredible achievement, not only in terms of saving costs, but also saving the burden of renal replacement therapy to patients where we know that this may actually correlate with mortality. So was your system linked to a specific clinical decision?
It wasn't. It was basically just telling people that this is happening and to pay attention. There was some advice given about consultation in nephrology or to critical care, consideration for medications, etc., but there were no specific actions. So our next goal is to link it, and so perhaps we can collaborate on this as usual and try to move the ball forward.
Absolutely, and I know that from January I heard we're probably going to revise the KDIGO guidelines for acute kidney injury, right?
I think that will be excellent. I hadn't heard that yet, but good to know.
Fantastic. With this, thank you very much for joining today Cappuccino in New Orleans with some jazz music on the background. And thanks to John Kellum and its fantastic team for this paper. Read this paper in Jason and you will be very interested. Thank you very much. Let's drink a cappuccino. Excellent.
Excellent.